Hello, my name is Jason Arnold, and this is my Capstone project PowerPoint presentation for Health Informatics Course 700. And the title of my actual research project was Evaluating the Impact of Antipsychotic Medication Delivered as Long-Acting Injections and Oral Medications, as well as related compliance issues. Now, the executive summary states that the project was implemented with specific efforts to conduct an accurate study that's going to utilize, a research methodology with the intentions to understand, specific questionings that's going to develop theories within mental health treatment and adherence. Now, the goal was the accurate conduction of scientific inquiries that's going to involve predictive analysis, as well as the analysis of evidence, the testing of alternative theories, as well as appropriate theory selection. Now, as far as the focus of this project, this project's focus was measured through observational research. Now, this observational research was utilized because of the investigation into the patients and the practitioners' perceptions, attitudes, as well as their insight into the mental health treatment and adherence. Now, the project looked to involve empirical concepts, which kind of resort themselves to observed or validated evidence, as well as scientific inquiry that's going to highlight a quantitative approach. Okay, and that approach is also known as positivism. Now, conversely, the quantified data and the facilitated statistical results for the desired outcome within this project was for objective knowledge. Now, those same statistical and numerical results were investigated through a tested hypothesis, and the tested hypothesis was about the compliance or effectiveness of the medications, and if they do not, or if they are not more impacted or better affected by long-acting injections over oral medications. Now, as far as the null hypothesis, of course, it's the opposite. It states that compliance or effectiveness will be impacted or better affected by the utilization of injections, long-acting injections, versus oral medications, those traditional medications, and that was observed and it was definitely monitored, and we will discuss those results. Now, the questions within this process, they were normative and descriptive, and they're going to address how impact was gauged and the data that was gathered about the features or outcomes or whatever treatment was utilized are going to normatively address what should be done, how it should be done, and the methods to get it done. The project is going to make sure that the effects or the results would be utilized through impact questioning, and we're going to make sure that they were relevant and related to the actual treatment. Now, I must acknowledge the Department of Behavioral Health, as well as Lakeview Behavioral Health Hospital for their guidance and their assistance in this matter. I definitely want to thank Department of Behavioral Health and Developmental Disabilities for giving me insight into the do's and don'ts of research, and to telling me parameters that would definitely help me or will not help me, and just giving me assistance that's going to better develop and keep me from research calamities like selection bias, as well as the Hawthorne effect, which we will discuss later. Now, the process wouldn't have been completed without the efforts and expertise of not only the participants, but just the people also who helped me out with the pilot study and any type of data collection testing. And because this research is going to be monumental in developing different methods of not only administration, delivery, but also continued implementation and processes and policies that's going to build the continuum of care, as well as build a body of knowledge. Now, quickly as an introduction, the objective of this project was again to make sure that the parameters within the medication adherence would be investigated, and we want to do that among individuals that were prescribed antipsychotic medications. And the parameters were garnered to make sure that the discovery or monetization of scientific, political, technological, and marketing forces, how they're used as how they'll be used to expand the continuum of care. Now, if we get into that specifically, scientifically, if we're talking about these things, um, we can talk about them from a perspective of actually understanding not only the different types of medications, but how the medications are absorbed, just different effects of the medication and utilization of the medication. Politically, as far as processes and policies that we just talked about, those things definitely would be a factor, not only through Medicare and Medicaid, but also supplemental insurances that they're going to affect how these managed care and behavior care facilities are responsible for care, and as well as the marketing forces and technological forces utilize television and consumer services that just warrant or tell people about not only the medication effectiveness but the dosage pliability. They want to make sure that all of these things are definitely are, are, are are highlighted, so they look like clinical advantages within or compared to other treatment options. And again, the hypothesis of this project was again to make sure that the applied results are going to formulate with future research, and we want to make sure that's going to be with quantified data. And as a background, we just want to understand that the mental health medications themselves, they've been formulated to recognize patterns that are going to have sensational aspects of scientific discoveries as well as pathological science. Now, the aspects were based on concepts that were proved to be more reactive than proactive, and these things definitely were done to benefit the patients, but long-term improvement was definitely never utilized. So the breakthroughs that are going to aid these, psychotropic medications, they again had their biggest onset in World War II. After a lot of the antipsychotics and antidepressants were utilized, they're going to control mental health processes, and these were times where of these medication formulations where individuals were starting to notice the effects and the side effects and the toleration of medications were beginning to subside. And it was the first time that breakthroughs within mental health were not only investigated but were shown results. Um, Now there were numerous treatments that were very barbaric. For tripulation, that was precursor to lobotomies, where areas of the brain were removed with a bore or an axe, to bloodletting and purging, which was just excessive, maybe vomiting or bleeding of the system that would to rid the body of bad areas of blood that was perceived. And then this kind of formulated into mesotrol therapies. After the formulation of outcasting people into the hillsides or into mental health asylums, then we started having more specialized treatment like Mercer therapies, which was induced stimulant therapies that were a precursor to electroconvulsive therapies that are gonna again a stimulant induced medication that would definitely were thought to help brain formulations, but did neither, as well as processes that were precursors to not only lobotomies, but also low blood sugar induced comas that were induced as far as medication. So it was a number of processes that were utilized and treatments that were utilized, but none of them were very, very effective in having long-term adherence. And so the formulation of these things outside of animal testing that were specifics into brain tissues and areas in the brain, this was when the utilization of long-acting injections became became prevalent, as well as implanted medication, and they're going to increase the development and the benefit of medication and how they're administered, and it's done systematically, which is going to reduce the reliability of oral medications, because a lot of times when you have people that are having adverse effects to medications or adverse effects to psychosis or stress, an oral medication might not be the best method to utilize, especially if they're being extremely aggressive. So by far, the usage of long-acting injections streamlined medications, but there were definitely formality issues that that were also investigated and assessed with the uses of long-acting injection. Now, as far as the research design methodology, now the the project was conducted through the basis of basic research principles, um, and this was done for detailed analysis um, of a research methodology. Again, that's within specific questioning or impact questioning, and this specific questioning, again, this impact questioning, look to um, just utilize or highlight not only descriptive but normative and impactful elements. Now, the focus of the capstone itself was make sure that standardization when it comes to utility, feasibility, propriety, or accuracy were also addressed. And the standardization made sure that we understood not only the correct information at the correct time to the correct person, or successful probabilities of time or duration of time, and expense utilization, the participant securities and stakeholder security protection, as well as just results validity within accuracy or the reliability or the sustainment of that reliability. Now, as far as the design process, the survey method, again, was the most appropriate data collection process. It definitely is a low-cost implication as far as the sampling is concerned. It's effective as far as the patient database that I utilize, as well as the ease of usage with low-level involvement or interaction. It helped me to do more direct observation while clients and providers not only filled out the surveys, but how they also thought about their processes. That was very interesting to see. We utilize a paper-based process because of not only security concerns, but I also wanted to make sure that the participants, the population that I was serving or researching, had an accurate assessment of not only what they were doing, but how they were doing it. I want them to feel comfortable because a lot of them are not computer savvy. So we want to make sure that we assisted them in the best way possible, but we also wanted to make sure that the security measures were taken because we also are using the information, or we're using participants that may be in a forensic element, and that is a criminal element. So we want to make sure that all those security parameters were definitely utilized. Now, the method related to the project research or the capstone, because we needed to utilize the data collection process that's going to develop the understanding of the patient's perceptions and insights and opinions, while trying to eliminate research bias as far as responses, as well as survey completion. I felt that this was the easiest way to have people that can complete a quick survey, can talk about the survey afterwards, and then I can just utilize that information within a really conducive environment to not only stand the experimental and the quasi-experimental components, but just to make sure that we're able to effectively research and analyze the information. Now, continuing, again, the data collection process. Now, this is just a timeline of the processes. I did it within the last 2 weeks of the first couple of months of research from February and March. Just a pilot process. I did it with the psychologist and the psychiatrist, as well as a psychiatry APRN, that's a nursing psychiatrist, as well as other mental health counselors. I did it in different areas, and I was able to address these people in these areas, and they gave their suggestion of whether it should be a survey or questionnaire, or only a survey or questionnaire, and their conclusions were everything from I needed to make sure I developed questionings into why adherence issues happen and not just how, the understanding familial concerns, as well as the medication delivery preferences for providers, and just the probability for selection bias, hence the need for a new location at Lakeview Academy, or a Lakeview Mental Hospital, excuse me. So ultimately, the test is ultimately the test measured the survey effectiveness, and it gave true sampling techniques that were stratified. Now, as far as the informatics component, now the current status within this process, the improvements within informatics process, um, uh, as far as the process of antipsychotic medication administration, is contingent upon the quality of the mental health services provided. Um, the quality is going to be, indicative or predict, the success or failure of mental health services around the board, and the facilitation of these achieved outcomes definitely going to drive mental health procedures and policies and implementations for years to come. So again, the success and failure of these quality measures, they're definitely going to be critical for the functional requirement of not only evidence-based practices, which is going to build a body of knowledge, but also it's important in understanding the quality that's emphasized within mental health care systems, because it gives assurance for the patients um, that they're receiving their required care, and that required care is going to be instrumental towards having patients not only improve their day-to-day life, but improve their quality of life and how they live, and the people around them and how they're affected. Now, what was done was that the project was done to highlight again the patients and the providers' perceptions in dealing with medication administration. Uh, but it was a evaluation research that's going to facilitate the assessment of these mental health treatments and services, and the impact that these administrative processes are going to have. So conceptually, the project just wanted to focus on the research development towards just measuring the limitations, as well as the accompanying compliance issues that combat medication delivery. Now, as far as the system improvement, first there needs to be an increase in the data that's going to be utilized for, like, transferring technology in the systems. And you just want to make sure that there's transparency within that system. Next, there needs to be like a structured involvement of like educators or proprietors that definitely want to increase the insight of mental health illness, which is going to help to disassociate these negative familial stigmas or negative perceptions that regard mental health practices and procedures, especially from a provider perspective. Third, there needs to be more transparency within like the policy development and design within comprehensive care, which is going to lead to the last element, which is growth measurements that account for, like, the building capabilities to guide comprehensive learning and development in not only rural areas but urban communities that are affected by low cost allocations, as well as just at not only the low cost allocations, but also socioeconomic inabilities. Now, the proper implementation of these parameters are going to be facilitated by, again, the investment allocations. So we want to make sure that we understand from a global perspective that these bureaucracies and government bodies and multifunctional agencies and community advocates, they're all working on one accord. Now, as far as the proposed solution or the activity now, the data analysis, now the data accrued within this research can vary within the perception of like insights, and accentuated the need for functional and structural improvement within mental health services. So the quantitative data from the OPN, the survey questions at the end of these questions, definitely suggested that the administrative process is one-dimensional and antiquated, and it's kind of ineffective for the long term. So the processes, as well as the implementation policies and research implications, they remain underrepresented within diversity of ethnicities or cultural sensitivities, as well as cost allocations of continuous treatment, and that's going to be combative within these specific populations. So the aggregated data was collected to make sure that, from a primary perspective, that it utilized the statistical conclusion validity, which was just pretty much just guaranteed accurate conclusion assessment of the relationship between medication administration, which is oral or injections, which is the independent variable, as well as the proposed outcome of no impact or impact between the uses of medication and injection, which is the dependent variable. Now, as far as the results are concerned, now the patient-centered results focused on mental health histories that each patient has experienced, as well as the diagnosis and the number of hospitalizations for each. And these streamlined understood that a lot of the parameters that the patients face had to deal with, again, repeated hospitalizations, repeated decompensation, or the symptoms coming back, repeated elements of being arrested. So the patient-centered results focus around that, and we wanted to utilize how, oral and injections, as far as medications, help to facilitate those calamities. The provider-centered results were more streamlined because they focus specifically on the preferences. And I wanted to do that because I wanted to make sure that the preferences were set, as well as the preferences of continuing treatment and diagnosis and the factors around it. So though they didn't get asked the same type of questions, the parameters definitely facilitated understanding of the medication administrative process and how impact is gauged. So these findings kind of illustrated that there was no impact of medication adherence when it came to consistency from either the oral medications or the injections. So therefore the hypothesis, the tested hypothesis of compliance and effectiveness not being more impacted or affected by utilization of long-acting injections in comparison to oral medication, it was accepted. And it illustrated the need for increased integration of community program elements, which is going to structure or do congruent structure. So the results were definitely confounded. I mean, there definitely were elements where patients were more inclined to utilize oral medications in one instance if it came to having adverse effects or having aggressive episodes, versus a patient having less utilization of injection when it came to everyday practices. So the scope of the solution was just to understand that this is a broken, antiquated system, and it's going to be aided by urban development and reconfiguration in the long term of things. Now, in conclusion, we just want to understand that the limitations within these studies range from the need to understand the community provider and the participation and time and selection bias to just a lack of concentration on diversity. I just feel like within any research, we need to make sure that we are continuing to have diversity in these research, because you want to have a well-rounded view of your research, as well as understanding the provider participation, the survey administration, as well as the assistance. And these research implications for the future just employ or suggest that maybe we can utilize some IT components that's going to help with educational apps, or we can just make sure that we're investigating parameters that just dissipate diversity within urban demographics. So we want to make sure that we're doing that, because that's going to be more beneficial, especially when these minorities become the majority in the next 10 to 20 years. Lastly, these are my references that I utilize within this research. And a few of my appendices is my Gantt chart as far as the survey administration and data analysis and results documentation, as well as things that I can utilize in the future as far as the system analysis of patient placement, as well as medication administration. I thank you for your time. I thank you for your energy. I welcome any questions, comments, criticisms, or concerns, and I thank you for this.